From kidnapping and illegal detention to alleged cases of prostitution, the POGO industry has since been marred with back-to-back issues. The Department of Justice is now alarmed over the spread of sexually transmitted diseases among POGO workers.
Within the POGO companies and within the employees of the POGO companies, there have been reports of the spread of sexually transmitted disease. Although we're trying to find out the full extent of this, it seems as though mga nasa 15 to 20 dun sa mga reports namin.
The DOJ said it has yet to determine how prevalent STD cases are among POGO workers. It has tasked the National Bureau of Investigation to focus on the issue.
Di na natin antayin ang panahon na umabot na to sa ating mga kababayan. And we hope that we're able to contain this as soon as possible.
372 foreign nationals will be deported this month. Majority are Chinese nationals working for illegal POGO companies. While over 48,000 foreign nationals will have their visas canceled after the government canceled the licenses of the POGO companies they are working for. They will be given 59 days to leave the Philippines or they will be deported.
Yung pag-cancel ng mga visas due to various reasons, kailangan nang umalis ng bansa yung Chinese nationals on their own. Hindi na namin sila arestuhin, and I think another advantage there ay mas mura na ngayon para sa gobyerno.
The DOJ says the immigration is still finalizing the documents for Chinese nationals awaiting deportation. For News 5, Marlene Alcaide, we are One News.
How alarming is this health situation in the POGO community? Let's get some answers from Dr. Jose Gerard Belimac. He is the manager of the Health Department's HIV, AIDS, and STI Prevention and Control Program. Welcome to the big story, Dr. Belimac.
Good evening, Sir Robbie and Ma'am Gretchen. Magandang gabi po sa lahat ng nanonood.
Doc, first of all, just to be sure that we're talking about something that we can, objectively report on here. What do we know about the situation of STDs among POGO workers?
Well, the Department of Health, together with our allied government agencies, is still confirming and verifying this matter. Nevertheless, the Department of Health would like to assure and convey the message that the DOH, with its very well-functioning surveillance system, is on top of this matter. And we will be getting back to the public once additional information is available po.
Mr. Belimac, is there any cause for alarm among the general public? How high are the cases? And can you give us probably how a detailed explanation on how STD spread and how why the alarm over the POGO industry?
Well, based on our data, ma'am, the STD and other the sexually transmitted diseases and the sexually transmitted infections are still prevalent in our country. Now, they are not yet eliminated, and the health system is still trying to control them via different strategies. Based on the data of our Epidemiology Bureau, the most common sexually transmitted infections that are reported are syphilis and gonorrhea. And looking at the trends as well, between January this year to June this year, the prevalence of these infections are in fact at 1.2% for syphilis and 7.9% for gonorrhea. So that's the data that we had. This is based on the specimens sent to the different reporting laboratories participating in the surveillance program of the Department of Health. One thing that is good for sexually transmitted diseases is we know the prevention of how to avoid sexually transmitted diseases. Isang magandang bagay po yan dahil alam natin po ang pamamaraan upang ito ay maiwasan naman. with the different prevention strategies.
Doc, balik ko lang doon specifically dito sa POGO industry in our story, and we stress, as you said, you still have to validate this concern, you're looking into it, you're monitoring, you're investigating, but as with all things with POGO, do we have that capacity? Are there challenges in actually monitoring? Even the Department of Justice is saying just accounting for all of the workers right now is difficult. A lot of these POGO workers have had their passports canceled, and some are hard to identify. Are there challenges even in just finding and accounting for them, even before you could get to the question of monitoring and finding out their health situations?
Yeah, thank you. Sexually transmitted disease kasi is difficult to establish in the very first place, no? Kasi most of individuals with sexually transmitted infections do not display symptoms. So it is very important that when an individual feels that the individual is exposed to a certain sexually transmitted infection, they are really encouraged to undergo screening and consultation. No? Again, it's difficult to establish the infection. Dapat kasi kailangang matest muna bago natin masabi that a person has the infection. So if the person do not present to the health center or to the clinics, they might go unnoticed, and transmission will happen from the close, intimate contact of that certain person.
All right, maraming salamat po, Dr. Jose Gerard Belimac, Manager of the DOH HIV, AIDS, and STI Prevention and Control Program.